Hi, my name is Michael Wallace. I'm a professor of medicine at the Mayo Clinic, Florida, and the current editor-in-chief of Gastrointestinal Endoscopy. I'm joined today by Dr. Tarek Sawas from the Medical College of Wisconsin, and we're discussing his recent paper in gastrointestinal endoscopy titled Self-expanding Metal Stents versus Plastic Stents for Malignant Biliary Obstruction, a meta-analysis. First of all, congratulations.
Thank you so much. Thank you for inviting me.
You're welcome. I wanted to ask you a couple of questions. Maybe we could begin with you just giving us a brief overview of the main aims and results of your study.
Okay, so yeah, the paper is mainly a meta-analysis, and the main goal was for this meta-analysis is to evaluate the role of metal stents, self-expandable metal stents, compared to the plastic stent in malignant biliary obstruction. We also tried to divide it into the hilar malignant biliary obstruction and distal malignant biliary obstruction, and the other aim was to compare also unilateral stenting with bilateral stenting. Our outcomes were, the primary outcomes that we were aiming to evaluate were the occlusion rate, and the occlusion rate we divided that into short term, meaning in the 30 days, and long term for a longer period of time. And the other primary outcome that we aimed for was the mortality rate, and the mortality rate that we evaluated was the 30-day mortality rate. Now, our secondary outcome that we looked for were the insertion success rate of the stent, the therapeutic failure, the complications that happened with the stents, and the reintervention rate, how many patients had to go through the reintervention. Now, our outcome results came that's for the, in general, if you combine both hilar and distal malignant biliary obstruction, self-expandable metal stents were superior to the plastic stents in terms of having a better occlusion rate. They have less occlusion rate in terms of the short term in the 30 days and the long term, the longer period of follow-up. Now, there was not much difference in mortality rate between the two groups. For the secondary outcome that we looked for, also self-expandable metal stents were superior to plastic stents in terms of having a better insertion success rate and having less reintervention and having less complications in terms of having less cholangitis. And so in general, we thought when we divided it into hilar and distal, we have almost the same result. There was not much different for the overall conclusion. For hilar obstruction, self-expandable metal stents were still superior to than plastic stents in terms of having better occlusion rate, has better insertion success rate, and less complications. For the distal occlusion, then the only thing that came insignificant is the insertion success rate. There was no significant difference between the self-expandable metal stents and plastic stents in terms of distal malignant biliary obstruction.
Okay, good. We've known for some time that in potentially resectable patients that we try to go directly to surgery without any biliary stenting, and particularly those that are going to go fairly quickly to a surgical procedure that no stenting may be necessary. Can you clarify, in your population, did you have patients who were potentially resectable or even underwent surgical resection?
Yeah, I agree with your point. Patient who will go to the surgery soon, they might not need to have any stenting done. Now, the studies that we included in our meta-analysis included patients who were unresectable malignant biliary obstruction. Those patients had more advanced disease. They didn't qualify to have surgery done, or having surgery were more risky of having the procedure. So all of them were not surgical eligible to be done. So that's why palliative treatment was more as a goal of care rather than having a surgery.
Okay. I was also surprised that even the short-term reocclusion rates, less than 30 days, were higher in the plastic stents versus metal stents. We've typically thought of plastic stents as perhaps lasting about closer to 90 days, but you observed higher reocclusion rates even in the 30-day window. Has that changed your approach then to these patients? Maybe perhaps the patient who has a very short life expectancy where we might in the past have considered a plastic stent, but your study might suggest otherwise.
The prior recommendation, they recommended, as you know, that to use plastic stents if you expect very short life expectancy, less than 90 days or 3 months life expectancy. And they usually define that if they have liver metastasis, those patients are at higher risk of having shorter life expectancy. So in the light of our finding now, these recommendations might maybe need to be tested again in terms, should we say even for a patient who, even if they have life expectancy of 3 months, would you even do the self-expandable metal stents over the plastic stents? Because even like you mentioned, on the 30 days period, you still have a better occlusion rate with the self-expandable metal stents. So you may save them repeating procedures. You may have better quality of life for the time left. So I think this is something need to be considered even for patients who have shorter life expectancy.
Good. Well, thank you very much. We congratulate you again on your article, and we look forward to seeing it in the journal very shortly.
Thank you so much. This was an honor being here.